Okay, hello everyone. My name is Cheryl Madamba with Metrics, and I'd like to welcome you to another Webinar Wednesday. Today's webinar is designed to provide guidance on how to use Metrics Metrocide OPA Plus Solution. It's intended to be an in-service webinar for educational training of new users or refresher training for current users. We aim to keep everyone up to date on how to use Metrocide OPA Plus, but we're also going to incorporate some general education about high-level disinfection as well. We want to thank you all for taking time out of your day to join us, and we hope you find today's webinar informative. The webinar is being recorded, and a link to view the recording on demand will be made available to you. All lines are muted during the presentation, but the chat function is open for questions, and we will be having a live Q&A following the presentation. Here's our overall agenda for the next hour. You'll learn the basics of high-level disinfection in general. Then you'll learn about Metrocide OPA Plus Solution specifically and best practices for using the product. You'll also hear responses to some frequently asked questions about Metrocide OPA Plus. And then following the webinar, we'll have a Q&A session where you will have the opportunity to submit questions via the chat function, and we'll read the questions aloud and do our best to answer them for the benefit of everyone in attendance. So we here at Metrics like to start every presentation by sharing our company belief, vision, and mission. This is what sets the tone for what we focus on every day here at Metrics and guides us in our work. Our belief here at Metrics is that no one, no patient, no staff, no family visitors should ever have to fight for their health over an infection they didn't have when they entered a healthcare facility. Our vision for the future is a world without any preventable healthcare-associated infections, or HAIs. We've made it our mission here at Metrics to protect people by working tirelessly to support healthcare professionals like yourselves in the fight against HAIs so that you can keep your focus, time, and energy on the most important thing, which is getting the patient better. The three pillars of our mission are our people, our team here at Metrics that lead with integrity and knowledge, our quality Metrics products built from customer needs, and our partnerships. And that's partnerships with people like you joining this webinar and staying current with high-level disinfectant practices to protect people. Let's start off our high-level disinfection discussion by first understanding what high-level disinfection is and when high-level disinfection should be done. The visual here shows three different levels of disinfection: intermediate level disinfection, high-level disinfection, and third, sterilization. The type of disinfection that should be done is dependent on the device or instrument you're disinfecting. Beginning at the bottom of the pyramid here, we have intermediate disinfection. Intermediate level disinfection is recommended for non-critical items in your facility. Non-critical items are items that come in contact with intact skin, and examples of non-critical items that only come into contact with intact skin would be stethoscopes and blood pressure cuffs. These non-critical items should be disinfected with an intermediate level disinfectant. Above intermediate level disinfection, we have high-level disinfection. High-level disinfection is defined as the destruction of all vegetative microorganisms, mycobacteria, small or non-lipid viruses, medium or lipid viruses, fungal spores, and some, but not all, bacterial spores. High-level disinfection is performed on semi-critical items. Semi-critical items are items that come into contact with mucous membrane or non-intact skin. Because they come into contact with mucous membrane, semi-critical items carry a higher risk of infection, so they require a higher level of disinfection via high-level disinfectant. At the top of the pyramid, we have critical items. Critical items, like surgical instrumentation, for example, are items that come into contact with sterile tissue or enter the vascular system. With these items, there is a very high risk of infection, so critical items require sterilization. The focus of today's webinar is high-level disinfection, which again is defined as the destruction of all microbial life with the exception of some bacterial spores. Why is high-level disinfection so important? Again, high-level disinfection is the minimum required disinfection for semi-critical items, those items that make contact with mucous membrane or non-intact skin, but do not interact with sterile body cavities or the vascular system. Many semi-critical items may actually be sterilized in your facility, and this is fine. Sterilization is the highest level of disinfection, so sterilizing is ideal. If you can throw a semi-critical instrument in the autoclave, throw it in the autoclave. There are, however, many semi-critical devices that can't withstand the high heat of an autoclave. High-level disinfection offers an alternative option for those semi-critical devices that may not be compatible with heat sterilization. Because high-level disinfection kills nearly all microbial life, the patient is likely not exposed to pathogens when using these devices. And that's the goal for everyone. Patient safety is top priority, and high-level disinfection has an important role to play in keeping the patient safe. Now we're going to dive into talking about our metric solution for high-level disinfection. This is Metrocide OPA Plus. Metrocide OPA Plus is our most popular high-level disinfectant. It's a product that's widely used in a variety of healthcare facilities. And we have many of you on the call from acute care hospitals as well as surgery centers, maybe some specialty practices or specialized reprocessing facilities. This product is everywhere. And we get a lot of questions and requests for education and in-servicing pertaining to this product, which is what brings us all here today and why we're having this webinar about MetriCide OPA Plus. Metrocide OPA Plus is a high-level disinfectant solution with the active ingredient orthothialdehyde, more commonly referred to as OPA. Metrocide OPA Plus is a one-component package, meaning it doesn't require any activation or dilution. It is an FDA-cleared high-level disinfectant with an approved 510K, and it's intended for use on heat-sensitive semi-critical medical devices and equipment. When used manually soaking, Metrocide OPA Plus has a reusability period of 30 days. There is a 14-day reusability when used in an automated reprocessor such as an AER. Part of the product training and education you need as a healthcare professional is knowing what PPE or personal protective equipment should be used while handling the product. You should wear protective equipment at all times when handling high-level disinfectants and contaminated instruments. Be sure to don your PPE prior to handling Metrocide OPA Plus. You should wear eye protection to protect your eyes from splash and splatter that may occur when you're immersing or removing instruments from the solution. Metrocide OPA Plus is a liquid solution, so you'll want to wear a fluid-resistant gown or apron. Nitrile gloves should be worn as well, especially if you're immersing instruments into the solution. You want to make sure the chemical isn't coming into contact with your hands. Pre-cleaning is another important topic to discuss because pre-cleaning is necessary before any type of high-level disinfection. Improper pre-cleaning can actually hinder the disinfection process regardless of what high-level disinfectant solution you use. We at Metrix don't specify instructions for what your pre-cleaning process should look like because that will vary drastically based on the devices you're disinfecting. So it's important to refer to the reusable device manufacturers labeling for instructions on disassembly, decontamination, cleaning, and leak testing of their equipment. Coming back to the reusability of Metrocide OPA Plus, this was briefly mentioned earlier, but it's important to reiterate here the varying use periods of our product. Once you open Metrocide OPA Plus, the solution bottle, the solution in that bottle is good for 75 days after opening. If you pour out a portion of the bottle, the solution that remains in that original container is good for 75 days after opening, provided that you keep the bottle closed when not in use and store the bottle in ambient temperature. Solution that you pour out of the bottle then has a more limited reuse period, and this will depend on the type of usage for the solution. If you use Metrocide OPA Plus in a manual soaking bin or basin, the solution may remain viable for up to 30 days. In an automated endoscope reprocessor or other automated reprocessing machine, the solution may be used for up to 14 days. After 14 days in an AER or 30 days in a manual soaking bin, the solution must be discarded, regardless of whether Metrocide OPA Plus test strips indicate that the solution has a passing minimum recommended concentration of OPA. Conversely, if the test strips indicate the solution has failed to keep a minimum recommended concentration of the active ingredient OPA, you must discard the solution regardless of whether the reuse period has reached its expiration. We'll discuss more about Metrocide OPA Plus test strips and how to use them shortly. Beyond being aware of the reuse period, it's also important to record dates pertaining to the reuse period. The first date to take note of is the date that the bottle is first opened. You'll want to record this date in the space provided on the Metrocide OPA Plus bottle label, along with the opened bottle expiration date of 75 days after opening. To determine the correct expiration date, you can count 75 days on the calendar, or if you're a little more tech savvy, you can ask Siri or Google the question, what is the date 75 days from today? And Google or Siri will provide you the correct expiration date to write on the bottle. Noting this information on the bottle label or on your own log sheet is important if you won't be using the entire gallon at one time. If you'll be pouring out the entire contents of the gallon bottle on the date of opening, this step is not necessary as there will be no solution left in the bottle to monitor for the 75-day expiration. Step 2 is to record the date the solution was poured out of the original container into a secondary container. You'll want to record this date in a logbook or on a label affixed to the secondary container. To reiterate reuse periods again, once a solution is poured into a gas station or a soaking bin for manual soaking, the solution has a maximum of up to 30 days of reuse. When used in an automated reprocessor, the solution is good for a maximum of 14 days after being poured out of the original bottle. Lastly, it's important to check the expiration date printed on the Metrocide OPA Plus bottle. The product's original shelf life will trump any of the reuse periods mentioned. This can be an issue if you have products sitting on your shelf for years at a time, which should not be the case for the majority of you, but once expired, the solution must be discarded. Because Metrocide OPA Plus Solution can be reused for multiple rounds of high-level disinfection of various devices, it's important to monitor the viability of the solution between each use to ensure there is enough active ingredient to achieve high-level disinfection each time. Metrocide OPA Plus Solution test strips were developed exclusively for monitoring the minimum recommended concentration, or MRC, of Metrocide OPA Plus Solution. Metrocide OPA Plus Solution begins with an initial concentration of 0.6% OPA. Over time and after each use, the amount of OPA in the solution decreases. Once the concentration of OPA in the solution falls below the MRC, we can no longer count on the solution to be effective at killing all the organisms necessary to achieve high-level disinfection. Use of Metrocide OPA Plus test strips is necessary to ensure the level of OPA in the solution doesn't fall below that MRC of 0.3% OPA. When using Metrocide OPA Plus test strips, you'll need some type of timekeeping device to keep to the required timing of the test. If you're unable to test directly from the soaking bin or automated reprocessor, you'll need clean polyethylene or polypropylene containers to hold a solution sample for testing. Lastly, you'll need a thermometer to confirm the temperature of the solution prior to disinfection. When you open the bottle of Metrocide OPA Plus Solution test strips, you can see in the picture here that again on this product label, you have to you have a spot to write the date of opening. Once the test strips bottle is opened, the test strips need to be used within 90 days of opening. Again, this is a time to ask Siri or Google, what is the date 90 days from today? It's not good practice to assume that 90 days equates to 3 months. It's important to be precise. Now we'll talk about the quality control test. Quality control tests are required each time a new bottle of test strips is opened. This will involve creating a positive control and a negative control and essentially testing the test strips. And we'll go over the step-by-step instructions in just a moment. So the QC test, or quality control test, will be performed on each newly opened bottle of test strips. This isn't something that needs to be done daily or done prior to each use. This is just for that initial opening of the test strip bottle. However, this is a critical required step to ensure the test strips are doing their important job of monitoring our high-level disinfectant solution. To demonstrate the procedure for the QC test, we have a video available on YouTube, and you'll receive the link in a post-webinar email. But I'm also going to share the visual now, and I'm just going to narrate myself since the sound doesn't come through well via webinar. But it's a great standalone video with its own narration if you like to see the demonstration each time you open a new bottle of test strips. So again, this is demonstrating the test strips of the quality control test for Metrocide OPA Plus Metrocide OPA Plus Solution test strips. Be sure to don proper PPE prior to beginning the test. Materials needed include unexpired Metrocide OPA Plus solution, the new bottle of Metrocide OPA Plus test strips, beakers, potable water, a pipette, and a timer. Begin by preparing the control solutions. Use a pipette or graduated syringe for accurate dilution of the negative control in particular. The positive control will require 25 milliliters of undiluted Metrocide OPA Plus solution. The negative control will require 10 milliliters of undiluted Metrocide OPA Plus solution and 15 milliliters of water. And be sure to mix the negative control thoroughly. Perform the positive control test by taking one Metrocide OPA Plus solution test strip and dipping it into the beaker, holding the positive control for 2 seconds. After dipping, vigorously shake the test strip once and hold horizontal for 1 minute. Be sure to use the timer. After 1 minute has elapsed, read the result against the Metrocide OPA Plus solution test strip bottle. The indicator pad should turn a magenta color. Perform the negative control test by taking one Metrocide OPA Plus solution test strip and dipping it into the beaker holding negative control for 2 seconds. After dipping for 2 seconds, remove test strip and shake vigorously once. Then hold horizontal for 1 minute, again using a timer. After 1 minute, read the test strip against the Metrocide OPA Plus solution test strip bottle. The test strip should indicate a failing color of either yellow or magenta with yellow spots. Repeat the positive and negative control an additional 2 times each for a total of 6 tests. In order for the Metrocide OPA Plus solution test strip bottle to pass the quality control test, all 6 tests must indicate the proper result. And that's it. Again, a YouTube link for this video will be sent in our post-webinar email, but we'll also review the details now. A proper QC test begins with proper preparation of the control solutions. Undiluted Metrocide OPA Plus solution serves as your positive control, and your negative control is a dilution of 2 parts Metrocide OPA Plus solution and 3 parts water. In the video and in our IFU, the given measurements are 10 milliliters of undiluted Metrocide OPA Plus and 15 milliliters of water. The steps to performing the actual test are shown. 1. Take a test strip from the bottle. Be sure to always replace the cap on your test strip bottle to protect the unused test strips. 2. Dip the test strip for 2 seconds, no more, no less. 3. Remove the test strip and give it one good snap of your wrist to shake off the extra liquid. Step 4. Hold the strip horizontally and set the timer for 60 seconds. Once the timer goes off, immediately read the results against the color chart on the test strip bottle. Solid magenta indicates a pass, any yellow indicates a fail. The test needs to be performed 3 times in the positive control and 3 times in the negative control. All positive controls should result in a passing color of solid magenta on the indicator pad of the test strips. All negative controls should turn the test strips either bright yellow or a yellow and magenta mix, indicating a failed test. What you're looking at now is a screenshot of our solution testing log sheet, which will be made available to you following this webinar. Your facility can, of course, create your own log sheet that will include all the details your facility chooses to monitor, as a lot of times facilities require even more data than what this example captures. However, what's important to note in this example is that this is where, after performing the test strip QC test, you'll want to log whether the test strip bottle passed or failed the overall QC test. You'll also need the lot number of the specific bottle tested, when the QC test was done, and by whom. This log sheet can also be used to record the details of the Metrocide OPA Plus solution prior to each use. These details include whether or not the solution has a passing MRC, minimum recommended concentration. Solution MRC needs to be confirmed prior to each use of the solution throughout the day. So this isn't part of daily management to be done once in the morning. This is part of the disinfection procedure each and every time you're ready to disinfect a new device. You'll definitely want a thorough log sheet that your staff will be comfortable with adding to multiple times a day if you high-level disinfect multiple times a day. Now we're going to go through the procedure for both manual processing and automated processing for our Metrocide OPA Plus solution. So this is getting into the actual high-level disinfection. You've confirmed your solution is within its expiration, within its reuse period, and contains at least the minimum recommended concentration of OPA as told by the test strips. Now you can soak your semi-critical device into the Metrocide OPA Plus solution for high-level disinfection. For manual processing, you'll need to immerse the device completely, eliminate any air pockets by filling all the lumens, and keep the device submerged for a minimum of 12 minutes at 20 degrees Celsius or 68 degrees Fahrenheit. Once high-level disinfection is achieved, you'll remove the device from the solution and rinse thoroughly in accordance with the device manufacturer's instructions for use. If you're performing high-level disinfection via AER, you'll set the AER to a minimum temperature of 25 degrees Celsius or 77 degrees Fahrenheit. Automated endoscope reprocessors will have preset cycles, but as long as there is this minimum temperature and a minimum disinfection immersion time of 5 minutes, you'll achieve high-level disinfection with Metrocide OPA Plus. There is a lot of importance placed on proper rinsing following high-level disinfection. These semi-critical devices are, as you know, making contact with mucous membrane in the body, so it's important to ensure that all chemical disinfectant residue has been thoroughly rinsed and removed from these devices to avoid patient injury. When it comes to manual reprocessing, a total of 3 separate rinses, each consisting of at least 9 liters of fresh water, is required. Special care for scopes needs to be taken to ensure all lumens are flushed with no less than 100 mL of rinse water. For an AER, the preset rinse cycle may be used so long as the rinse cycle has been validated by the AER manufacturer for use with OPA-based disinfectants. Disposal is another topic we're asked about often. When it comes to disposal of the solution, the requirements are going to vary greatly for each facility. Your local water authority should be your best resource, as they'll understand the intricacies of your city's particular sewage system and the chemicals that may require neutralization before being introduced to the waste system. The container should not be reused, but it is recyclable. Dispose of the bottle in accordance with your hospital policy. There is a contraindication for Metrocide OPA Plus and for all OPA solutions really, that these solutions should not be used to process any urological instrumentation used to treat patients with a history of bladder cancer. OPA solutions also should not be used to process instruments for patients with known sensitivity to Metrocide OPA Plus solution or any of its components. Metrocide OPA Plus solution also should not be used to sterilize heat-sensitive medical devices when sterilization by a biologically monitorable process is not feasible. High-level disinfection of rigid endoscopes is recommended by the CDC and APEP. Some quick review before we go into FAQs. Metrocide OPA Plus open bottle stability is up to 75 days after opening. AER, high-level disinfection, is achieved at 25 degrees Celsius for 5 minutes. Manual high-level disinfection, manual soaking, is achieved at 20 degrees Celsius for 12 minutes. The quality control tests for the Metrocide OPA Plus solution test strips are required for each new bottle of test strips. You need 3 strips for the positive and 3 strips for the negative control. Results should be logged on a log sheet. Metrocide OPA Plus solution test strips opened bottle stability is 90 days after opening the test strip bottle. Minimum recommended concentration, MRC, must be tested prior to each disinfection cycle, and results should be logged on a log sheet. There are no indications for sterilization using Metrocide OPA Plus. Now, these FAQs may sound redundant, but they are important questions that we are asked over and over again, so we'll go over them now. Do I need to check the temperature and MRC before each use? Yes. During the use of Metrocide OPA Plus solution as a high-level disinfectant, it's recommended that a thermometer and a timer be used to ensure that the optimum conditions are met. Do you recommend a specific thermometer for testing the temperature of Metrocide OPA Plus solution? We don't have a specific thermometer recommendation, but generally facilities will use a waterproof digital thermometer that they stick into the solution or an infrared insta-read thermometer. What neutralizer do you recommend? We at Metrix don't recommend a specific neutralizer, but the following are most commonly used by our customers, and that is Glued Out by Civco and ChemSafe by ChemMed. I want to send you all some educational resources, which include a link to our Metrocide OPA Plus in-service video, a link to our Metrocide OPA Plus test strips quality control test demonstration that we watched together, Metrocide OPA Plus wall chart, and a quick reference guide for using Metrocide OPA Plus test strips. The wall chart and quick reference guide are available from your Metrix sales rep as a laminated poster for your facility. For a complete list of warnings, precautions, contraindications, adverse events, and safety instructions, please see the Metrocide OPA Plus solution package instructions for use. And for any product or technical information on Metrocide OPA Plus solution and Metrocide OPA Plus solution test strips, please feel free to call us here at Metrix at the number listed or visit our website, metrix.com.